Hello, everyone. Professor Baik here. Welcome to your cardiovascular system lecture. In this lecture, we're just going to briefly review the functions of the cardiovascular system, a little bit of the anatomy and physiology of it, cardiac dysrhythmias, and then we're going to talk about diagnostics that are used to evaluate the cardiac function, and identify major risk factors associated with cardiovascular disease. These are your learning objectives. So let's begin with just an overview of the cardiovascular system. So the cardiovascular system is made up of the heart, blood vessels, and approximately 5 liters of blood that continuously circulates throughout the body at any given second. So the main job is to deliver oxygen and nutrients to tissues while removing waste products with the help of the lymphatic system and carbon dioxide. The heart acts as the body's pump, and it works through two circulatory pathways. You have the pulmonary circulation, which sends blood to the lungs for oxygenation, and the systemic circulation, which delivers oxygenated blood to the rest of the body. So structurally, the heart has 4 chambers, 2 atria on the top and 2 ventricles on the bottom. So blood flow is directed in one direction through a series of valves that open and close as the heart contracts. Remember, blood flow flows in a one-way direction. Okay? It's extremely important to remember because when it isn't flowing, then it can cause problems. Another important feature of the heart is its own electrical conduction system, which generates impulses that control heart rhythm and contractions. So basically, you need that electrical system to create these nerve impulses so your heart can contract, heart muscle can contract, right? It's just a muscle. It's not going to contract unless there are those nerve impulses. So now as individuals age, the risk for cardiovascular disease increases. Hypertension or high blood pressure is the most common cardiovascular disorder and is a major risk factor for complications such as heart failure, stroke, and kidney disease. Lifestyle factors such as physical activity, body weight, and overall fitness also plays a huge role in cardiovascular health. So in severe cases such as advanced heart failure or certain genetic disorders, heart transplantation more than likely will be needed. Now let's review the major functions of the cardiovascular system. As we mentioned before, the biggest function is delivering oxygen and nutrients and hormones to tissues throughout the body, and removing carbon dioxide and other waste products. This constant circulation, honestly, is essential for maintaining cellular function and the big word, homeostasis. The system also maintains blood flow to vital organs, for example, the heart, kidneys, lungs, through 2 main circulatory pathways, your pulmonary circulation that carries blood to the lungs, as we mentioned, for oxygenation, and systemic circulation that delivers the blood to the rest of the body. So now blood travels through the arteries and veins and capillaries. Arteries carry blood away from the heart and have thick muscular walls to withstand higher pressure. Veins return blood back to the heart and have thinner walls with valves and help prevent backflow of blood, especially in the lower extremities. Now, this is all in that part of your, anatomy. So please, if you are not understanding this concept, please review your anatomy because you're going to need to understand these concepts before we start talking about diseases. Blood vessels are composed of 3 layers. The tunica interna is the inner lining that allows the smooth blood flow. The tunica media is the middle muscular layer that controls vessel diameter and blood pressure. The tunica externa is the outer connective tissue layer that provides support and protection to the vessel. Here is a picture of these 3 layers. Please review it, and like I said, please review your anatomy if you do not understand these concepts. You're going to need that to understand disease processes. So now let's look at the cardiac conduction system. We said that the heart has to have a conduction system in order for the muscles to contract, right? So this is the heart's specialized electrical network responsible for initiating and coordinating heart contractions. So this system ensures that the chambers of the heart contract in a precise sequence. It has to be in a sequence for the blood to be pumped efficiently throughout the body. Okay, it all has to work together, coordinated. The conduction pathway begins. The conduction pathway begins at the sinoatrial or SA node, which is called the pacemaker of the heart. It's located in the upper wall of the atrium. The SA node is the pacemaker of the heart because it generates the initial electrical impulse. So it basically initiates that impulse that helps the heart contract. So these impulses, when they're initiated, they spread across the atria, causing the atria to contract and push blood into the ventricles. Then the electrical signal reaches the atrioventricular, the AV node, located near the bottom of the right atria. The AV node then briefly delays the impulse for about 1/10 of a second. This pause is extremely important because it allows the atria enough time to fully empty the blood into the ventricles before ventricular contraction begins. Like I said, it has to be very coordinated for all of this to happen. So the pulse, the nerve signal is initiated, the atria contract, push the blood into the ventricles, and the AV node delays the next signals to give enough time for the ventricles to fill and the atria to empty. After the delay, the impulse then travels into the AV bundle, also called the bundle of His. This pathway divides into the right and left bundle branches, and a picture of it is right here, right? The right and the left, bundle branches that carry this electrical signal down to the center of the heart toward the ventricles right here, right? And so at the base of the heart, the signal spreads through the Purkinje fibers, triggering ventricular contraction and pumping blood into the pulmonary artery and aorta. Now, just to kind of give context to how important this is, think of it this way. The heart is the size of your fist. Everyone's heart size is different, right? So your heart is the size of your fist is the size of your heart. And this little thing, in that little thing, the ventricles are pumping the blood to the entire body, right? And in order for that to happen, a lot of things have to be working, right? You need to have good blood flow. You need to have strong muscles. And this electrical impulse has to be so efficient that it contracts. It helps the ventricles contract good enough to pump the blood throughout your body and then return back to the heart. So the conduction system functions, through two major electrical phases. Depolarization, which refers to the initiation and spread of the electrical impulse. This is where the heart cells change from a negative to a positive charge. Then you have repolarization that restores the cells back to their resting state so the next heartbeat can occur. So the electrical activity of the heart is monitored using, all of this is monitored using an electrocardiogram or an ECG. Sometimes we even call it an EKG, right? Which helps detect dysrhythmias, like abnormal rhythms and conduction abnormalities. Now, damage to the conduction system, such as from electrolyte imbalances, like remember in our fluid and electrolyte lecture, we talked about potassium and how it affects the heart rhythm. Like low potassium and high potassium, too much potassium can cause peak T waves. So these are important these are very important concepts to understand, right? Or even infection along with or hypoxia can also interrupt signal transmission and lead to a heart block. So there's so many things that can cause these problems. In the first degree, there are different types of heart blocks as well, right? In the first degree heart block, the impulse is delayed. This causes that prolonged PR interval in the ECG, right? In the second degree block, some impulses fail to reach the ventricles. This can cause occasional missed contractions. The third degree block or complete heart block occurs when no impulses travel from the atria to the ventricles. And what's going to happen when that's the case? This basically causes the ventricles to beat independently at a dangerously slow rate. So the atria aren't going to contract properly and push blood into the ventricle. And if the ventricle doesn't contract at the right time, then it's not pushing enough blood into circulation. So all of these things have to work in coordination for the heart to pump properly. Now let's talk about cardiac dysrhythmias, right? We said these abnormal signals can cause dysrhythmias. Sometimes we use arrhythmias, sometimes we use dysrhythmias. They're basically used interchangeably. So these are abnormal heart rhythms, and they're caused by disruptions in the electrical conduction system, as we mentioned. These abnormalities interfere with normal cardiac function and reduce cardiac output, which is not a good thing, right? We need enough cardiac output to circulate the body. Common causes for these include conduction system damage, electrolyte imbalances, hypoxia, infection, stress, smoking, caffeine, and underlying heart disease. So the SA node, which is the pacemaker of the heart, SA node dysrhythmias include bradycardia, with a heart rate below 60 beats per minute, tachycardia, which is a heart rate of 100 beats, more than 100 beats per minute. Atrial dysrhythmias include premature atrial contractions, atrial fibrillation, and atrial flutter. So what is AFib? And it's very common these days, atrial fibrillation. It's especially important because it increases the risk of blood clot formation and stroke, right? Because what happens if the atria does not pump the blood, all of it, into the ventricles, some will remain in the atria, and if you have blood remaining in a spot installing, then it's going to turn into a clot. So heart blocks will happen when impulses are delayed or blocked, basically, between the atria and the ventricles. Now, in a severe third-degree heart block, the ventricles will just beat independently, as we mentioned, at a dangerously slow rate. Now, ventricle, these were atrial dysrhythmias. Now let's talk about ventricular dysrhythmias. These are the most life-threatening because think of it, the ventricle pushes the blood out into our system, right? And if these ventricles are not contracting at the right time and right speed and the right strength, it can be life-threatening. So ventricular tachycardia, we call it VTAC, reduces cardiac output. So your ventricle is just contracting really fast, but not really pushing the blood out. So while ventricular fibrillation causes the ventricles to quiver instead of pumping the blood effectively. So basically they're quivering and they're not pumping the blood out. So it's useless, right? I mean, they're just quivering and not pumping blood out. And the one job the heart has is to pump blood through the system. Cardiac asystole, or a flat line, we call it, is the complete absence of an electrical activity. This requires immediate intervention, right? I mean, we all know that. If there's no electrical activity, we'd be dead. Common symptoms for these different types of these fibrillations, these dysrhythmias include palpitations, where people will tell you, oh my God, it feels like my heart is skipping a beat, or it's going fast and it's going slow and it's skipping a beat. Dizziness, this can cause dizziness, fainting, shortness of breath, weak or rapid pulses, and that's why it's so important to monitor pulses. Severe dysrhythmias can lead to a cardiac arrest very fast. So all of these are extremely important for us to check. So now let's look at common diagnostic tests, right? We talked about, remember the funnel we talked about in one of our lectures where once we know these signs and symptoms exist, now what can we do? What can be done to verify this information, right? To validate this information. So these are the diagnostic tests to validate cardiac disorders. First, you have the EKG, the electrocardiogram. It evaluates heart rate, rhythm, conduction abnormalities. You have the PQRST wave, and all of these, as long as they're working in coordination, will have a perfect wave, right? Commonly used, the EKGs are also commonly used to diagnose dysrhythmias, MIs, heart blocks, and pericarditis. So as soon as somebody comes to the ER, complaining of chest pain, that's the golden standard. We do an ECG. It also detects abnormalities such as ST elevation or prolonged PR interval, irregular rhythms. Another diagnostic test is a Holter monitor. It's a portable ECG device. It's worn continuously for 24 to 48 hours or longer. It records electrical activity during normal daily activities. It helps identify intermittent dysrhythmias, palpitations, syncope episodes, and activity-related rhythm changes. So basically, when a patient goes to a cardiologist and says, hey, I'm feeling palpitations, or I'm feeling dizzy, I'm blacking out, I'm feeling short of breath, all the symptoms of cardiac disease, the, the cardiologist will order this Holter monitor, they're going to wear it, they're going to go home, and they wear it throughout the day. And anytime there is an irregular rhythm, it records it and it sends it to the cardiologist. And so it kind of monitors patients. Sometimes people wear it for longer, sometimes people wear it for 24 to 48 hours. Then you have the exercise test. This evaluates cardiac function during exercise, right? Or medication-induced stress. They'll put these electrodes on you. You kind of stand on a treadmill or or you turn the pedals on a bicycle, stationary bicycle. It basically assesses for coronary artery disease. It also checks for exercise-induced dysrhythmias and myocardial ischemia. It monitors ECG changes, blood pressure, symptoms during activity. Other common diagnostic tests for cardiac disorders include, for example, echocardiography. We call it an echo. It's an ultrasound image of the heart. Basically, an ultrasound of the heart. It evaluates the chambers, the valve function, wall motion, ejection fraction, basically how much blood the heart is pumping out into the system, systemic circulation. That's your cardiac output. It measures that. It's commonly used to diagnose heart failure, valve disorders, and cardiomyopathy. Then we have our golden standard, a chest X-ray. Basically visualizes the heart size and lung fields. It helps detect cardiomyopathy, pulmonary edema to see if there's any fluid there, any pulmonary congestion or effusions like fluid in your lungs. Then another one we have is the CT or MRI. These are both very advanced. They're only used for, when doctors couldn't figure something out with an echo or the chest X-ray or other diagnostics. So the CT scan basically identifies coronary artery calcification and vessel abnormalities. MRIs will identify myocardial tissue damage, structural abnormalities, if there's something wrong with the structure of the heart, like the heart walls or or the vessels or, the chambers. And it also helps to identify blood flow patterns, like checking to see, okay, is the blood flowing properly? Is it being atria contracting, sending it into the ventricles pushing it out, or are they holding it inside the chambers? Nuclear imaging. This uses radioactive tracers to evaluate myocardial perfusion, see how perfusion is happening. It assesses blood flow to the heart muscles, any areas of ischemia, and infarct size. If the patient had a MI, then the size of the infarct in the muscular tissue. Other ones are the invasive specialized procedures are the cardiac cath with angiography, which is an invasive procedure. Basically, we use a cath cath is inserted into the heart vessel, as you can see here, heart and vessels, and a contrast dye is used. And as the contrast dye is flowing, the cardiologist is able to visualize the flow of the blood. So it detects any coronary artery blockages, any valve abnormalities, chamber defects. It can also measure pressure within the heart as well. Then you have auscultation, simple old good school auscultation, right? Where we put the stethoscope on the chest and we listen to heart sounds. You can hear murmurs. You can hear any extra heart sounds, the S3, S4s. You can hear valve abnormalities. If the valves are not opening and closing properly, you hear those murmurs. Or you can hear turbulent blood flow. Then the last one is the Doppler studies. This is ultrasound basically, and it evaluates blood flow. It can evaluate a peripheral vascular disease, blood clots like DVTs, any obstructions in the arteries, and venous insufficiency. Now, these are the lab tests that are normally used to, assess cardiac function. These play a very, very important role in monitoring cardiovascular disease. One of the most important groups of tests is the cardiac enzyme evaluation. During a myocardial infarction or heart attack, the muscle gets damaged. And so when it gets damaged, it releases specific hormone markers into the bloodstream. Troponin is the most sensitive and specific indicator of cardiac muscle injury, while the CKMB and LDH1 are additional markers that also help confirm myocardial damage, muscle damage. Cholesterol studies are also used to assess cardiovascular risk, right? Because remember, cholesterol causes atherosclerotic plaques, and these plaques can block vessels, and these can cause cardiovascular problems. So the cholesterol tests measure total cholesterol, LDL, or what we call bad lipids, HDL, or what we call good cholesterol or good lipids, right? And triglycerides. Elevated LDL, the bad one, and triglyceride levels obviously will increase the risk of atherosclerosis and coronary artery disease, while HDLs, the good cholesterol levels, are generally the protective ones because they keep the blood clean. They protect your vessels. So next time you think about eating that Big Mac or those French fries, deep fried food, just think about what kind of cholesterol you're putting in. And so it's always when we're educating patients, and even ourselves, our families, our communities, it's important to know what is good and bad for your cholesterol levels. Now, other inflammatory markers, such as C-reactive protein or CRP and erythrocyte sedimentation rate, which we call ESR, also indicate inflammation, right, within the cardiovascular system. So any elevated levels could suggest ongoing tissue injury or inflammatory process that contribute to cardiovascular disease. But remember, these are not specific to the heart, right? The ones that are specific to the heart are more the troponin. That's specific to cardiac muscle inflammation. So arterial blood gases are also labs that are done. Our ABGs, we covered this in our ABG lecture. They're often monitored during the acute cardiac events, for example, myocardial infarction, like a heart attack, right? Heart failure. ABGs will evaluate oxygenation, carbon dioxide levels, acid-base balance. This helps clinicians identify hypoxia because remember we said hypoxia can then cause dysrhythmias and cardiovascular problems. So the ABGs help identify hypoxia and assess the severity of the respiratory or circulatory problem. Because remember, the respiratory system and the cardiovascular system work very closely with each other. Okay, and that is it for our first lecture on the cardiovascular system. And the next lecture will cover specific cardiovascular disease and the patho.